Welcome, everyone, for another session of Practice Perspectives from the Bob Barkley Study Club. I'm Dr. Paul Henny, and I'm here with my longtime co-host, Stan Kingma, and we have the tremendous privilege of interviewing Michael Sonick today. And Michael is somebody that I've really just come to know over the last couple years. Michael is a graduate of the University of Connecticut School of Dentistry, and he did his postgraduate training in periodontics at Emory University. Mike's story includes relationships and training under veritable who's who of people in periodontics and restorative circles, names like Harold Lau and Tarnow and Picos and Misch and Coyce and Garber and Coachman and you name it. That's just the short list. So we could go on and just talk about the people that Michael knows and has close relationships with and all the things that he's learned from them. But that's not why we're here today, actually. We're here today because last year Michael wrote a book that really got my attention. This book, if you haven't read it yet, is an amazing book, Treating People, Not Patients. And it's an absolute fact that Michael is a standout clinician and an outstanding lecturer and presenter. But there are very few people in dentistry that I've met that have his kind of heart. And what do I mean by that? I mean his other-centeredness and his understanding really of how to make a patient's experience with the practice before, during, and after really special, so that you can build trust and brand. And you've taken that to very, very high levels. You've got close relationships with people in the hospitality industry, where you've gotten ideas and merged them into your beautiful office. And you write extensively about that in your book. I think that's all fascinating and important to read. Why? Because if you're going to play this game at the high level, particularly the relationship level, particularly the full fee-for-service level, you got to be playing top tier in every way, not just clinically, but you got to be delivering on the emotional level and the physical and the psychological. And your place needs to stand out in their mind at every point of contact. And we're going to get into that today. So let me just turn it over to Michael, let him introduce himself. I'd really like to hear from Michael, kind of where did this all begin? This idea of really creating this high hospitality, high touch, high tech, high skill practice experience that you've been doing now for over 40 years. So why don't you jump in right there, Michael?
Most of us end up where we are because we look in the rear view mirror and then we sort of figure out, that's why I'm doing what I'm doing now. So a lot of things during the early part of my life, as a student, as a young child in high school, and when I started working, sort of interplayed to create, the point of view that I have today. And I think the easier answer, and I don't know if it's true, but the easier thing to say is like I was always working. And Steve Anderson, practice management consultant, I had dinner with him about a year ago, and we were talking about hiring because that's a very important part of building the practice and having the right team. And then he says, when I interview somebody, I was telling him my philosophy, and then he goes, the question I always ask is, what was your first job and how old were you when you did your first job? And that's a really important question because it sort of creates, who that person is, who's that person being. Because I've had people work for me, doctors, other periodontists, that their first job was working in my office is very different than the person that, grew up, working, from the age of 10 or 12 or delivering newspapers, et cetera. So I always had a strong work ethic. And I think it all started with my mom and my dad, as most things do. My dad was a World War II veteran. He grew up as an orphan in Bridgeport, Connecticut, grew up very poor, was in the war, was wounded. And he said things to me like, hard work never killed anybody. And he had me working and moving bricks and building walls, and he had a furniture store. He was an engineer and he wanted to be a dentist, but he didn't think he could be a dentist because he was 26 when he got out of the war. He figured I wouldn't be a dentist. I'm 30 and that's too old to become a dentist. I think part of him regretted it. And so I think that's part of the reason I became a dentist, but the work part came from him. And so I always worked. And it's not something I enjoyed as a kid, but it sort of created this work ethic that like I can't stop working right now. And one of the things that's happening right now in my life, I'm 71. My wife says, "You're going to slow down," and I just have so much passion for what I'm doing, as you do too, Paul. And during my career working, I worked for my dad, and probably one of my first jobs was a lifeguard, where I was in the service industry. So I took care of people on the beach, fix wounds and things like that. And then I decided I'd leave for the summer, and I worked in the hospitality business. I worked in Saratoga Springs, New York. I worked in 4 or 5 different restaurants. I bartended. I waited tables. I worked in Kennebunkport, Maine, on the water there in a large operation. And that's when I started to really get into service. I was only about, 20 years old. And I met this guy. He had a handlebar mustache. And he drank really fine wine, which was Lancers or Mateus. and I was drinking Boone's Farm. And he showed me how to uncork a bottle of wine, which I never knew. And he carried his own wine uncorker with him, whatever it's called, corkscrew. And so I got one. And then he showed me how to remove crumbs from the table. I really got into it. And then I started bartending there. I started playing cocktail piano. And for some reason, I just got into the whole hospitality thing there. And then I started cooking. And then I realized, and I took boarders in when I was in college. I used to do all the cooking in college. It was $15 a week to have dinner in my house. And I did all the cooking, then the cleaning. And then I took in people in dental school. It was $25 a week then. It was breakfast and dinner. You get 5 breakfasts and 5 dinners for that. I do all the shopping and cooking. And I really got into the presentation, which my mom showed me. And it was the whole experience of connecting with people. And it wasn't just about the food. It wasn't just about making great food. It was like having a good experience. And then when I started became a dentist, I just said, I want to give these people a good experience. My experience as a child, and we don't have time to go into this, but I had terrible experiences as a kid. I didn't have any dental role models. I had just the opposite. My dentist smoked cigarettes as he was working on my teeth. Literally had yellow fingers with a cigarette burning in the lab, listening to news radio, and with his wife next door screaming because she was losing her sight. It was just a crazy, crazy scene. I was thinking, this is never what I want to do. And the connection with dentistry and hospitality is I lost my teeth when I was 8. I had a very bad bike accident. So I went throughout high school without my 2 front teeth. I had 2 little brown stubs. Because back then, because I had my accident when I was 1961, back then they weren't crowning teeth when you're young. You want to wait till your body stopped growing. And so they didn't put temporaries in there. And so that's how I started in dentistry. And then I lost 9 teeth, and I had a lot of dentistry throughout the course of my life. So my area of expertise is aesthetic reconstruction of the anterior teeth. I do a lot of anterior implants because of my own problem. And I didn't realize that I even did that until I was in my 40s. It sort of came back to me. But the connectivity piece really is very joyful. And you write about it so eloquently in your book, Paul. And thank you for giving me the opportunity to be on your show. I have tremendous respect for what you do and the work of Bob Barkley, which I'm sure we'll get into. But I created this whole thing a la Bob Barkley without knowing who Bob Barkley was. It's sort of like I backfilled my story with Bob Barkley after I was already practicing that way for a long period of time. When I first saw him, I go, that's the way I practice. Arvin King and all those other people. I wasn't involved in it with them. It's only lately that I started to read more about them. And I'm thinking we have the same point of view.
Yeah, well, I think, that's what's fantastic about it. It's timeless stuff, timeless wisdom, timeless ways of connecting with people, timeless ways of being a more effective teacher, how to set up more effective learning environments so that all of that can happen more smoothly without people feeling threatened, and the end result of all that being people making better decisions for themselves and
right.
Collaborating with you instead of working against you or whatever. So all these things are highly, highly interrelated. Your story is very interesting to me because I have a bit of a past in the food scene and retail scene and high-end retail scene. Right. And a very close friend of mine ran one of the highest end retail tabletop stores close to Tiffany level. And I learned all about lighting and displaying and how to create an experience from the moment a person walked in the door, which got me real dialed into thinking about all of those things and marry that into a practice experience. So when I read your book, I'm going, boy, this guy is like simpatico with where I come from and the way I think. So I'd love to see that. What's particularly unique about your situation is you're a specialist. And frankly, you probably wouldn't need to do any of this to stay busy and make a good living. You're doing it because it's part of who you are. It's in your heart. And that brings you a lot of joy, connecting with people in a deeper, more effective way.
Yeah, I didn't do it. I don't do it to make money, although I make money. I mean, but that's not why I do it. I'm not going to mention the guy's name, but someone reached out to me from another country who's a plastic surgeon, and he sent me his book. And I've been reading it, and we're very similar, but he talks about it's written for other doctors, other plastic surgeons, and it talks about you do this, you'll make more money. So I think we're about the same age. I mean, I'm a little older, but when I graduated from dental school in 1979, we were just so happy to be there to do this. We weren't thinking about money. Now, when kids come out, they can make a lot of money if they really know what they're doing. But I know people in their mid-30s that are making close to 7 figures. They're not doing the dentistry the way I would want it to be done, but they can do that if you can sort of set that area up. But that's not my motivation. It's one of them, but it's not my main motivation. My main motivation is probably very similar to yours, is to improve the quality of the patients' lives and the people that I serve. So it's a servant-hearted business. And I've always been servant-hearted. I didn't know I was always servant-hearted, but I always was, even from high school. And not so much in college. College was I went to a small school in upstate New York, Colgate, and it was a school of 2,000, a town of 2,000. It was sort of like isolated. I mean, I just read a lot of philosophy and a lot of literature. I didn't do much up there. And then I went to dental school, and then it got all turned on because Harold Lowe was there. I didn't realize who Harold Lowe was when I started. Most people, but most people don't know Harold Lowe, even most periodontists. Or they go to Lowe Index. They don't realize who he was. He's the father of modern periodontology. Until he did his study in 1965, where he took a toothbrush away from 21 dental students, and everybody bled within 10 days. Nobody knew that bacteria led to periodontal. There was no proof. That was 1965. It was not long ago. And but I didn't know that he was as good as he was, or who he was. And that's where my philosophy of practice started. And I guess he had a Bob Barkley philosophy that the patient, you got to treat the whole patient, not just treating the teeth. And I don't know if you knew this, but we had very, very small amount of requirements when I graduated from UConn. We had to do everything that patient needed. So let's say we had to do 30 crowns and 2 dentures and a couple of surgeries or whatever. If my patient needed requirements that I'd already satisfied, I'd still have to treat that patient, finish everything. Most schools, you trade patients like baseball cards. My daughter went to the University of Texas at San Antonio, and she had to do 5 or 6 times as much dentistry as I did, but they weren't teaching them comprehensive care and treating the comprehensive patient, which I think is important. So I think it's just real important that we just connect with people that way and develop that strong human relationship, because there's a lot of burnout in dentistry. I read recently that 50% of all physicians would not go back to medical school again because they're burning out. And they're burning out because of the lack of connectivity, because they're worried about DRGs, procedures, what the insurance is going to cover, et cetera. And that's a terrible, terrible burnout. So I may have gotten off topic there a little bit, but I apologize.
No, that's all right. I mean, I think part of it, a big part of it really is how you view the profession on a philosophical level. Do you view yourself as a curer, or do you view yourself as a healer? Yeah. And and we leave dental school with that curer mindset. I'm going to fix you. Yeah. And then it just becomes, I'm going to fix you faster and faster. I'm going to do it through delegation, and I'm going to do it through more technology and more of this and that, versus collaborating with a person and them learning more about themselves and learning how to take care of themselves better and making better decisions, to the point where you're a facilitator of healing. Do you do some, is some curing a part of that process? Absolutely. But you're not taking the problem away from the person. You're not, and that's why I spent a fair bit of time in the book talking about boundaries. Yeah. You're not violating their personal boundary. You're having them maintain ownership of the problem. And that's how we all grow and develop, is being confronted by challenges that other people aren't going to come in and rescue us from our problem. I was listening to an interview of a a fairly well-known pollster who had a history of being a lawyer. And he said when he first got out of law school, he went into a small law firm and the principal of the law firm sat down with him on his very first day at work. And he said, I want to tell you, the answer is no. And he said, what do you mean the answer is no? He said, what I mean is I'm not going to tell you how to do anything. You're going to have to figure it out for yourself. Mm-hmm. And he said that was the best piece of advice I'd ever gotten. I learned how to be a better lawyer faster by struggling and confronting the problems myself. Was he there for assistance every now and then? Yes. But he said the answer was no. Forced him to own it. And I think that's a problem that for efficiency's sake, for making more money more quickly and so forth, we tend to rob people from their problems, and we take away from them the opportunity for them to grow and be more independent. And Barkley was big on all of that.
Yeah, I totally agree. There's the victim mentality that a lot of people feel when they come in there. This is done to me. This is what happened to me. I go, okay. I call it the 90-second rule. I give people 90 seconds to talk about the problem. I said, now we're going to link that to the solution. So let's talk about the solution. And I'm not the solution. Okay. I'm actually a guide. I know more about dentistry than my patients, but I don't heal them. And I always say, I'm going to suture somebody up, which I do on a daily basis. And the wound is together. But unless somebody comes in there and heals them, and it's not me, that wound's not going to stay closed. And most of what I do is sort of an aid to the patient, but the patient has to be responsible. And, there's an expression, I don't remember who said it, but it's the body is the hero. The body is the one that's going to do all the healing. And you have to put the body in the right position. And this doesn't apply just to dentistry. It applies to every aspect of life. So I'm just working, I'm a specialist in a very small part of the mouth, this 1 millimeter, but I get access to the whole body. And what I have become in my family and amongst friends is one of my roles is I do a lot of mentorship of everybody, not only dental people, but people in my family. And in the last 3 or 4 weeks, I've had the opportunity, the privilege really, to be the person, the medical concierge in my family. People have been in and out of the hospital, and they're pretty much being tested to death, and then no one's going to the root of the problem. And the root of the problem in every case was the patient, who was my family member. I have a niece, I have a father-in-law. They've all been in and out of the hospital. And what they're doing is they're testing here to testing here. But the problem is really inside them, and they're not really diagnosing it. And almost no one does that. And a lot of people look at me. I've been on committees of a lot of, meetings that we put together. And my point of view is never really mainstream. They go, well, we got to learn how to do this graft. We got to learn how to do this. I just came back from the American Kid Academy of Periodontology. I moderated 3 of the most well-known periodontists in the world. And I'm watching them, and everyone's going, oh, look at that gum graft. None of it really needed to be done. You just show them how to brush and floss, give them some ownership, and they wouldn't be there in the first place. And it's one of my pet peeves in dentistry that people don't take the time. So a lot of my team is always pushing me sometimes. They go, Mike, you're spending too much time with the patients. I go, yeah, I am. It's not too much.
Yeah.
50% of my day is talking to people, 50% are doing some procedures. And I'll tell you right now, and I don't care if periodontists are listening, a large percentage of what we do is, as periodontists, is not necessary. We do too many procedures. It's really, we don't educate. Let's say you go to a heart surgeon, right? You're going to have bypass surgery or have some stents placed in or whatever. How much training do you get on diet? How much training do you get on exercise, on sleep, on mindfulness? Those are the really important things that you need to do. No, we're going to put a couple of tubes in your heart. We have 25 miles of vessels in our body, but these 2 little tubes right here are going to make a huge difference, because it's a procedure that they get reimbursed for. And this is not the philosophy that we're taught in school. I mean, how many hours in dental school or medical school do you get on human connectivity and how to be there for the patient? Almost none. I didn't get any.
As you mentor younger dentists, do they resonate with this? I mean, is it not true that they're mostly focused on procedures and the good income they're going to make? And how do they respond when you say, hey, deal with the whole person, consider things other than just dentistry, consider diet, consider these things that are not within your profession? Do they hear that?
No, I don't know if they do. I'm a teacher, but I'm more of a mentor. What's the old expression? When the student's ready, the teacher's going to appear. Most of our studies in school have been, designed to us to do well on multiple choice tests and essays, which have nothing to do with the real world. The educational system is gamed not to really making you a better doctor, but a better student or a better person that can regurgitate information. And I don't trash any generations. I don't say the millennials or Gen Z or Gen X. I think people are people. I get that question all the time. Do the new people, does this resonate with them? Well, it doesn't resonate with the old ones. I don't think I don't think the dentistry of my childhood was very good. The golden age, it was terrible. It did terrible. At Bob Barkley's time, dentistry was terrible back then. Now we have everything's done digitally. The communication's a little different because everybody wants to text or use apps. Unless they're our age, we want to talk. We want to have a conversation. And that's the way we communicate is a little bit differently. But what has not changed is right here in the heart, that people want to be connected to on a human level. I don't care how much AI comes along and how much digitization, everything that's going on right now, we're getting bombarded by thousands of messages to stimulate a day. And what we're not getting bombarded with is love and human connectivity. So if you do that, you have a niche. And I always say that there's no competition in a niche practice. When you're in a niche, and that could be any niche you want, but right now my niche is love and human connectivity. I can do whatever I want. I could charge whatever I want. I don't, because I don't think that's fair. I don't want to manipulate people, but I can manipulate my patients to do whatever they want. I'm the expert in the room, right? They don't know anything about their mouth. What they do know is, am I present? Am I looking them in the eye? Am I connecting with them? Am I going to be there for them? Or am I going to be a cookie cutter? I'm going to do the same thing for everybody, because some people do that. And I think that's unreasonable. So when you say, does this message resonate? It resonates with the people that already get it. So I do probably 3 keynotes a month right now on this topic. And the people that really love it are the people that really don't need to hear it because they're already doing it. Paul, when you and I talk, we're doing it. It's like, oh yeah, we're soulmates in this. We feel very simpatico, as you said. But people that don't get it, once I start to show them that not only is this important, but I do beautiful clinical work and I can show them, bone graft. And I always throw a few cases in my lecture on this because I have to credential myself. And I should show my tax return too, that it's worth it to do it this way. But I don't. But I say you can. I just tell them I'm booked 4 months in advance. That's all they need to know. You book 4 months in advance and I talk all day long and I still make a living. And that resonates with them. I'll tell you what resonates with young people and older people is this going to benefit me? Because most people are not, they're not always altruistic. They don't always think about in abundance. There's a scarcity mindset. And if I'm going on too long, you can stop me anytime. But I think there are 4 types of people out there. One type of people I call, those are losers, bottom feeders. These are people that think they're losers, know they're losers. They're not even going to try. They're there. Those aren't dentists. We don't see those people. Then there's the wannabes. There are some dentists like this. These are the people that go and take a Tony Robbins course and they come back and they go, yes, I got it. I'm going to do it. And they're good for 3 weeks and then they go back to their old life. And then they're conventionally successful. And that's the majority of dentists. The majority of dentists make enough money. They can get into the country club. They can see what the really wealthy, really successful people do, but they just want to keep their piece of the pie. They get a new technique. I don't want anyone else to know it because I want to keep that here in my office. And that's a conventional success. And then there are people like both of you guys, what I call the transformational people. These are the ones that are they're not scarcity mindset, they're abundance mindset, and they know a lot and they want to give it all away because by giving it away, they still know it and they make the world a better place. And that's where I come from as a dentist. Every one of my lectures is online free. You can get anything I've done is online. A lot of doctors, I don't want to give you that lecture. Why? You're going to write a book and not give me the book? You're going to keep the book in your back pocket? You give that information away because when we give everything away, we make the world a better place and we become better. We become more abundant mindset. So that's how I come. That's how I come across when I'm teaching, when I'm talking to other people. I say, give it all away. And by showing that generosity, most people are generous in return. And the world, I think, looks really better. I love my life. I love what I do. I think I think I'm really privileged and I've been given a lot. I still walk and talk and still use my hands. I'm born in a good country. And I just, free and get to do what, I turned out what I love to do. Did I become a dentist because I love to work with my hands and do dentistry? No. I ended up becoming a dentist, and I'm thinking, for a lot of different reasons. And now, I'm a dentist. Well, what am I going to do? I can help people. Dentist is a lot of fun. That's my perspective.
Right.
And I think with that kind of perspective, you can make a great improvement in the people that we serve. But what I haven't mentioned is the most important part of all this is building a successful team around you that are aligned. And Paul, you wrote 2 brilliant essays on that. I loved them. I read them twice. I downloaded them. I'm going to start taking some notes on those. I think you really put that together really nicely.
Well, those are bits and pieces of the next book that may take me another year to get together, but I'll keep you in the loop on that.
Yeah, no, I loved it.
I can only on this, just kind of extend out on Stan's question a little bit more. I can only speak to this from the point of view of a restorative dentist, and the benefit that I have experienced and help other people experienced and seen over and over and over and over again for decades now is that when you take the time to connect with people and you do love them, as Michael just said, you share of yourself for the purpose of truly helping people. You're, as they say at the Pankey Institute, quid pro quo, meaning give before you receive.
Mm-hmm.
Then what happens is more people buy comprehensive care. And that's the doorway through which you can separate yourself from insurance and raise your fees up to a level that's appropriate and allows you to do the kind of dentistry that you want to do and get better and better and better at it.
Right.
But if you don't take the time to connect with people, that's an impossibility. You're running a commodity-based practice, and you're letting the insurance industry run your life and your peers, whatever else is happening around you in your immediate marketplace. So, but I think even the more important thing for me to say on that topic is it's got to come from your heart. It can't be a strategy. It can't be a Tony Robbins course, just like you said. It can't be, you just learn 5 new ways to manipulate people through heuristics. That's not going to get you there. It's got to be who you are. And I think that's an essential part of this conversation today is that how Michael came up as a person and merged all these life experiences in with his practice of dentistry. Practice of dentistry wasn't his passion in the beginning, but he brought all of the other things, merged all those things into it, and created passion within dentistry that just, as you can see, just listening to him, bubbles out of him. And the patients can feel that. And he's been very careful in hiring the right kind of team members that support his mission, and on you go. And that's how you get freedom. That's how you get a practice where you're doing most of the things that you enjoy and you're staying away from the rut that everybody else repeatedly finds themselves in.
Yeah. Those are very good points. I like what you said about the freedom, because I think it's freedom, to be yourself. Early on in my career, sometimes I remember walking into my first periodontal meeting, and it was at the Pier Hotel in New York City, and all the periodontists were just in fancy suits, including myself. And I had this little black binder. I'm walking around like I'm a periodontist, I'm walking in here, but I was so insecure. I was, $100,000 of dollars in debt. I didn't know anything, and I'm nervous in this room. And I had an attitude because it was covering up my own fear. And I think sometimes you get that early, sometimes it goes away a little later. Sometimes you never get it. But the freedom, as you talked about, Paul, to be vulnerable and to be open really resonates with the patients that we serve. And I always share myself with them. You saw in my book, it's here. My partner, my partner says, you're sharing quite a bit of personal information in your book. I said, yeah, I did, because I don't know if I'm comfortable doing that. My partner's in the book, but I had to change his name because he didn't want his name to be in the book. That I won't tell you who it is, not publicly anyway. He'll tell you personally, but he didn't want his name there because he wasn't comfortable doing that. That was, a few years ago when I wrote it. Now he'd probably be a little bit more comfortable. But I think Brene Brown talks about this a lot, about the power to be vulnerable. So when I'm vulnerable with my patients, share part of myself, it's amazing because my partner said to me, early on, because he's from mainland China. And he said, you connect so easily with patients, because I practice in my hometown. I'm 200 yards from my high school. He goes, that's because you know everybody. I go, I don't know most of my patients. Most of them moved from out of town. What I do know is how to connect with them. And all of a sudden, it doesn't take long. It's seconds, right? You know that. It's like it's a blink moment. I just will say something and I will be able to connect with them. And I see this. I was just moderating a talk this weekend with Joe Kahn. I'm sure you know him as a real well-known dentist. And he's great. He connected with everybody that talked to him. Everybody was an individual. Dennis Tarnow, my mentor, same thing. He connected with them. He always stopped to look at you as an individual. He didn't look around the room if there was anybody else. And early on in my career, I had a coach that came in the office and says, Mike, you're really good, but you got to slow down. I go, what do you mean? I'd be talking to the patient, walking out of the room as I'm finishing the conversation because I was so busy and I was so important. And now I do a little thing, and your listeners might want to mirror the same thing. I go, okay, we're done. Do you have any other questions before I leave? And then I pause. I don't say anything for like 2 or 3 seconds. And I said, is there anything else? Because now's the time I'm here. And they go, no, I don't think I have anything else. I go, are you sure? I'll ask them 3 times. And as I leave, before I leave, my assistant will hand me my business card, which has my cell number on it. I said, well, sometimes things will come to you, or maybe your spouse wants to call. Here's my cell. Please call me. And there's that human connection, because that's what do we call at our office, a wow experience. Nobody else is going to do that, or very few people will do that. How many times does a doctor ever give you the cell number? If you even get the doctor, and they don't even look you in the eye. And a lot of my, human connectivity piece comes out of great hospitalians, people in the hospitality industry. I look for that all the time. I've become super sensitive to it. Then when I'm such a bad critic. Almost nothing is great anymore when I'm out there, because I say, oh, I missed that. They missed that. They missed that. There's always an opportunity to connect. And when things don't go wrong, that's when you got to connect more, because not everything goes right for me.
Right.
I'm a surgeon.
This reminds me of what just happened. We were just down in Charleston, South Carolina this past weekend, and I got a reservation at a restaurant slightly north of Broad that I've been eating at for probably 25 years now.
Yep.
And you have to plan pretty far ahead in advance to get a table, much less at an appropriate time there.
Right.
And so we showed up on time, and they were behind schedule. And we stood there for maybe 7 minutes when the manager of the restaurant stepped up to me, introduced himself, shook my hand, and he said, I am so sorry that you have to wait. I'm going to make sure you're going to have an excellent excellent experience this evening. And within just a couple of minutes of that, they set us at the best table in the restaurant. It was a 4-top, and there were just 2 of us, but he made sure. And then the staff was just at every step of the way made sure that we had a good experience. And it's exactly that. Things are always going to go wrong, no matter how well oiled your machine is and how great your systems are. But it's your recovery and your intention that really matters. That's when people really experience the philosophy behind the systems. And you need to set your practice up that way as well, so that whenever there are bumps in the road or things take a little bit of a left-hand turn, you've got ways of reassuring people and making certain that people understand that you're there to help and that you truly care.
Danny Meyer talks about that in his book, Setting the Table. He says you have an opportunity to write the end of the story. Don't let the customer do it. You could have written the end of the story. What a lousy restaurant. I'm not going back there. But no, that was an opportunity. Now you're telling me about that story. And when I have trained, basically the way we do what we do is our own training. We train ourselves. I mean, we're influenced by others, but it's our own mind doing it. And I can react to people, places, my thoughts. But then when I usually stop and I go, where's the opportunity here? What is the opportunity for me and for the person that I'm serving to make it better? And I'll tell you, when I have a complication, sometimes they're happier than if I didn't have a complication. Not that they're happy that they had one, but their experience with me is like, I am there. I can't run away. Oftentimes people want to leave complications. You see it all the time. And it's just, it's a big mistake, because then they're going to talk about it. They're going to talk negatively, or maybe they won't talk about it, but they will certainly talk about it in a really positive way. I had something happen to me that's really not completely related to this, but it's worth telling. I usually stay in really nice hotels. Oftentimes I don't have to pay for them either. And I was staying at the Ritz Hotel in Atlanta, where I did my training, and I go there at least once a year. And I went out to Decatur, which is to this little grocery store I used to go to, and and I had lunch, and then I took an Uber back to the Ritz, and I go up to my room, and the key's not working, and I tried, it doesn't work. So because I'm very judgmental and arrogant, and I'm always looking for something wrong, even in my own life, I go to the front desk with a little bit of an attitude. I didn't say anything negative, but in my mind, I have an attitude. I go, my key's not working. And they look at the key and they go, well, you're staying at the Four Seasons. So I feel like a jerk, right? So the hotels looked alike to me at the time. And I go, I'm sorry, where's that? They go, it's 2 miles down the road. And here's the kicker. They go, would you like one of our cars to drive you there? Now, here is the Ritz saying to me, you're staying at our competitor, but we're going to drive you there because you made the mistake. I mean, that's really rewriting the story.
Yeah.
There's an opportunity. Do we have an opportunity? Because we as dentists always say, what? Oh, we got to redo all your dentistry. I sometimes have to talk patients out of going through dentistry that they don't need. I call that saving a patient from themselves, because they don't know. They think, I want this. My friend had this done. So this is all good stuff.
Yeah.
I'm not running from it. There's a book called Run to the Roar. It was written by, I can't remember the guy's name, but he was the squash coach at Trinity, and they had the longest undefeated seasons of any Division I school in the country. I think it was like 13 years of never losing a game in squash. And what he taught his players was, when you hear a roar, you want to run to it. Roar could be some sort of a conflict, because in the savannah, a lion will roar. But what you don't know is that there are going to be 8 lions on the other side of the forest, and as you run for the roar, you're going to get eaten. So he says you want to run to it. When you run to it, then you can control your destiny. And I think it's really, and that's the same with patients. Doctors can't be victims either. We can say, well, I hate this, I hate this. I've been to dinner with about 15, 20 periodontists in the last few days. All I heard was whining. Oh, what about this? What about this? What about this? They have no control. They're letting everything else happen to them. You hear it now at politics, whining. Okay, bottom line, it's probably not going to really have, if you don't look at the news, it will have no impact upon my life. I'm going to go to work. I'm going to see my wife. I'm going to have dinner. I'm going to talk to you. I'm going to go home. I wouldn't know what's going on in the real world. But people feel very, very much victimized. And I always say to some of my friends, I go, how long are you going to be sitting in that chair? They go, what chair? I go, to victim's chair. Is it time to get out of there and take a little bit of responsibility for your own life? And I have 3 kids, and they're always coming at me. They know they get 90 seconds with me. Actually, my kids get more. So I actually have 2 girls. They can go on and on and on, because who else is going to listen to them except for their dad? So,
well, to piggyback on your thought there about talking people out of doing dentistry, there's a corollary to that I think is really, really important. And it took me a while to learn this, but it was certainly one of the important steps on the pathway to practicing a much more happy and fulfilled way, which is a saying that I learned early on called holding out for the best interest of the patient. And the interpretation of that is, when we get into a situation where our overhead is high and we've got these production goals and this and that happening, it's very, very easy for us to just go for the low-hanging fruit to get the production numbers on the board. Mm-hmm. And it wasn't until I learned the ability to just say, okay, let's just do this when you're ready. That became my most effective closing statement of all time, when I stopped taking pressure off of people and letting them decide when they're ready. I'm doing 2 things. I'm letting them get prepared. It's not that I dropped the ball in terms of my case presentation skills or whatever, but I needed that. I need the person to be ready financially and psychologically, and I don't want to rush in and take the problem away from them. When that person leaves the room and do exactly what you suggested. You hand in their card or call me if you have any questions, or if your spouse would like to come in, and I'd be more than happy to review this with them as well. I know this is a big, expensive, complex decision, and I have no expectation for you to be able to make that today in this short amount of time. When I allow that to happen, what happens more often than not is that person comes back in a very short amount of time. Their mind is made up. They've got their financial situation figured out, and now they're my treatment partner. Now we're working together to solve a problem that they understand and have chosen me to be their care partner. This is real. This is really powerful stuff. Now, it's easy for me to say, this is what you need to do, but it took me like 20 years to figure out that was actually going to work.
Yeah, that's my daughter's a dentist, and she went to school at San Antonio. And when she was there, she was they don't really teach a lot of treatment planning there. It's mostly a procedure-oriented school. And she wanted a treatment plan because, she grew up with me. And I said, when you give a patient choices, give them a treatment plan. Don't give them more than 3 because it gets a little confusing. It's like buying a car. There's like a million different cars to buy out there. Just sort of say, these are your options. But the first option is always you can do nothing. And I start with that with the patient. We can do nothing. And then they get a little nervous because they want to do something. I go, you don't have to do anything. Because oftentimes dentists will call me up because I'm the specialist. Not so much anymore because most of the dentists I work with have the same philosophy. But they'll say, you got to get this tooth out. I mean, it's going to fail. And I say a lot of things that you may not have to get it right out right away. And it's the dentist wants it out. A lot of dentistry is done because of the dentists, not because of the patient. There's an article written, you probably saw it in the CBS News about implants.
Yes.
A lot of that's right. You see a lot of it. I do implants, but I know some practices that do 100, 200 arches a year. And as a periodontist, I know I can still save teeth. And it's sad that article is coming up, but there's some truth in it. But there are some very ethical people that don't treat that way. And so, a lot of the people who were quoted in the article, George Mandelaris, Will Ginobili, they're good friends of mine, the periodontists that I know, Paul Rosen. And, those are reasonable things, but that's what people sometimes see. And because we know so much, it's easy for us to manipulate. But we could also use that same knowledge to help. I oftentimes will tell patients that, because they're scared. One of the things when patients come in to see you or I, they're vulnerable, they're scared, they don't know how much it's going to cost, they don't know how much pain's involved, they don't know if we're any good, they don't know how long it's going to take. It worked for my friend, but how's it going to work for me? Even if they know that you're the best in the world, until it's proven on their own body, they're not going to really believe it. So I tell my patients, I said, listen, I'm going to tell you everything that I can that's going on in plain English. And I said, make believe that I'm the Wizard of Oz. Okay, you're in my kingdom now. I go, and I'm going to show you. And we open up the curtain, and it's just me. I'm just a guy here. I'm just a guy that happens to have gone to school and knows a little bit more than teeth than you do. I go, but I'm just a regular person. And everything that I explain to you, if it doesn't make any sense, don't do it. It has to make sense to you. And when I have that kind of conversation, you can see it. You can see what happens to me. You see it, I'm sure, too, Paul. It's like, I'm in the right place. And I tell patients that before I even tell them the treatment plan, because they come in like this. I said, I know you've gone through a really difficult time, and I want to congratulate you because you walked into this office, because it probably took you a few years to walk up those steps, and you're here. But I want to assure you something, that you are in the right place, and I'm going to take really good care of you. And if there's anything that I say or do that you disagree with, please stop me now. I said, because we're in this together. I go, I am part of your team and you're part of my team. We're going to work together. And as like Barkley says, as collaborators. And, when I read that when I read Bob Barkley's stuff, which nobody in my world knows who Bob Barkley is, I'm the only one. Periodontists don't talk about this. When I saw that, I'm going thinking, God, that's how I think. And that was how many years ago? 70 now? Not 50 years ago.
Yeah.
Yeah, it's pretty cool.
Do you know that you guys are talking about the essence of every sales seminar for any profession? This is the secret to enjoying life and enjoying what you do. and helping people. It's in every profession.
Right. Totally agree. We're salesmen. And I tell you, that's a dirty word. When I became a dentist, no advertising, don't say sales, we're professionals. Well, where does professional come from? Prostitute, right? We're selling service. We're selling our services is what we are. And we're selling our services to people, and we want to do it in an ethical manner. And the value that we give has to be greater than the money that we receive. You want to give tremendous value.
Well, it depends on what you're selling. And I think if we're selling and promoting health, then we have something that's high value and high ethical. Right. When we turn something like implants into a commodity, then that's where we get in trouble. And that's how we get these articles written about the profession that are very damaging, when we forget that there's a person attached to that mouth or that tooth. And that person that just walked in the door is not another sales opportunity. Right. They're an opportunity for somebody that we can help in deeply profound ways that may affect the rest of their life, hopefully in a very good way.
Yeah.
And so I think that we have to take it that seriously, because it is to me that important. And I know it is to you, Michael, as well.
Yeah.
We've gotten close to 50 minutes on this conversation, and I suspect we could spend another 50 minutes and wouldn't realize how long we've been talking, because all of this is so very important to everybody on this screen. So I think we have one of two options. I think we really need to wrap it up, because people are not signing up for a 2-hour conversation when they stumble on to this kind of information. So we can either continue this at some point with another set of conversations that we put together, or perhaps we should just wrap this up and say, well, the bottom line, folks, if you're watching this long, is here's kind of what I have to say to you. So I'm opting for that right now, just to keep this short. So let me start with you. And Mike, just how would you wrap this up? If somebody's watched this long, they're saying, wow, I would like to think like that.
Yeah, well, try it. Go in on a Wednesday to your practice and treat one patient. And just try this philosophy with that one patient, and try to do ideal dentistry. Take your time, be honest, and take some programs, not just on dentistry, but on human connectivity, study neuro-linguistic programming, for example, and start to take some courses on how to connect better with people. And it's in the sales courses, because sales courses are, you can use sales both for good or evil. You want to use it for good. And you can't teach integrity. So if you have integrity and you want to become better at what you do, just look for ways to connect better with people. And the way I recommend people do it is just practice when you go to get a cup of coffee in Starbucks. Spend that extra moment, with the barista. And when you go into an airport lounge, say, oh, thank you so much. Say yes, sir. Say no, sir. Be on time. Say what you're going to do and do what you say. And you follow it's basically the golden rule. And if you treat people like you want to be treated, then life works out pretty well. But we sometimes don't do that in our careers, because we get worried about the money and everything else. I can't say ignore it. It's going to take care of yourself, because you can't ignore it. But be mindful of how you're treating other people. And I'll tell you, it's going to come back to you. My life today is so good. I mean, if I miss an airplane, I don't complain or something like that. I'll just walk up there. Is there anything else? And 9 times out of 10, I get a first class ticket to go right back, because I'm just being nice to somebody. I see this happen all the time. It's what you put out there. Yeah. And I just got a good quote that someone gave me the other day. It's the life you live are the lessons that you teach. So just try to live that good life. It's simple, but it's really hard.
Excellent. I would say, if jumping in and doing that on Wednesday is a little bit of a bridge too far, I would say pick up Mike's book.
Oh, thank you.
And read it. And if you haven't read mine, read it. And not only read it, but slow read it and make notes in it and think about it. And then think about ways to start applying that in your life, as Michael suggested, in everyday life, at Starbucks, or in your practice, because there are 100 opportunities every day to connect with people more effectively if you just think about it. think about the way you have things laid out. And Mike's book goes into a lot of details on how to do that, how to create a more hospitality-oriented experience for your patients, which creates the opportunity for better conversations, and better conversations lead to better decisions, and better decisions make for better outcomes. And it's not a whole lot more complicated than that. If you're feeling like you're high stress and you're trying to get too much done in a day and you're really not as productive as you really want to be, the answer is to slow down and connect with people more effectively, because you'll end up doing a lot more dentistry on fewer people, and you'll feel a lot better about it at the end of the day and the week and the month. So that's how I would close it out, Stan.
Well, for those of you watching, you've listened to two experts who are doing a wonderful job in their professions in dentistry. If that is of curiosity to you, you'd like to know more, contact Paul, and we'll see you the next time. Thanks for joining us.
Thank you.
All right. Till next time.